Alright, so before entering the patient's room, I would want to check the chart, perform hand hygiene, put on PPE, enter the room, provide for privacy. Hi, my name is Nina. I'm going to be your nurse today. Today we're going to be doing a neuro and muscular assessment on you. Can I get your name and date of birth?
Susan Piali, January 20th, 1953.
Okay. And while asking her subjective data, I can also gather some of my objective data. How are you feeling today?
Good.
Good. Any pain, stiffness?
No.
No. Do you take any medications?
No.
Any surgeries to the brain or spinal cord or any traumas?
No.
No. Do you have any tingling or numbness in any part of your body? Any headaches, dizziness?
No.
No. What do your daily activities consist of?
Just doing dishes, laundry, chasing a 3-year-old, nothing.
Do you try to use proper posture?
Yes, I do.
Okay. So we can tell she's using proper posture at home. I'm also noticing her positioning. She is relaxed. She's erect and relaxed. So she's not slouching over, which is a good sign. I'm also noticing that she has proper hygiene and proper grooming. She's also dressed appropriately for the weather. She has a normal expression on her face, and she does not have like a flat affect. It's appropriate for the exam, what we would expect. So we have assessed her appropriate responses as well. She was able to follow verbal commands by answering the questions. I noticed that she's able to, her eyes are open spontaneously. And so that's 2 off of the Glasgow coma. We can give her a 4 and a 6. So we could start by saying, do you know what year it is?
2016.
Okay. Do you know where you're at?
I'm at home in one of my bedrooms.
Okay. And can you tell me your name?
Susan Piali.
Okay. So with doing that, I know she's alert and oriented ×3, which is another part of the Glasgow coma scale. So she would have a 15 on the Glasgow coma scale, which is excellent. That's what we want. After she, again, responded appropriately, and during this whole assessment, I would check to see any signs of maybe depression through her words or any hopelessness. I could also maybe ask her, do you have any problems with depression, suicidal thoughts? No? Okay. So if she was not oriented to time, we could test, if prompted, we could test her recent memory by asking her about something that she's done today, but we should know what it is we are going to be asking them. Or if we're testing her past memory, we'd ask her something from maybe a week ago. We'd also want to check her attention span, which she's here with us. She's not off doing other things, so I've got her full attention. I'm also inspecting her muscles and her legs and her arms. I could ask her if I did see atrophy, which I don't, if maybe she had a broken arm or if she suffered from polio as a child. But she does not have any atrophied muscles. They look equal bilaterally, symmetric. Same with her legs. I don't see any atrophy. No abnormal signs of muscle problems. So I could also go ahead and check off some of my cranial nerves that I need to for the moment. So I would have her shrug her shoulders, all right, and then push against my hand with your face, okay, and then this side. All right, so every cranial nerve 11's intact. She's able to do all of that. Another one that I could do for the moment is have her grab my fingers and squeeze as hard as you can. Alright. Now, I noticed that her grip was strong, so I'm going to have her grab my fingers again, pull me towards you. Alright. And then grab my hands again and push me away. So she's got a strong grip, and she's able to pull and push, which is a good sign. Later, we'll check her feet. But for now, I'm going to go ahead and check her gait to make sure she has a steady gait. So go ahead and stand up for me. And I'm going to stand right here. And I'm going to have her walk, and I'm going to assess how she walks. Alright, now turn around and walk the other way. I can see that her gait is steady. That's good. So now we're going to want to do the Romberg test, where we have her close her eyes, and with her feet shoulder widths apart, close your eyes for 20 seconds, and then you always want to hold their back or be near their back in case they fall. This is going to be another test to test cranial nerve. Number 8. We do it for 20 seconds. They may see a little bit of swaying, but they should not fall over. So she did not. That's a good sign. She passed the Romberg test. So I could go ahead and have her sit. So I found that her gait was steady. She passed the Romberg test. Again, throughout this whole thing, I'm noticing if she has any signs of distress, if she's having any trouble walking, which I did not. So now I'm going to have her lay down, and we're going to check a few of her reflexes, as well as, I'm just turning the camera, as well as check those feet to see if they are also equal symmetrically with the push and pull. So first I'm going to have her slide her heel, or can you take this heel and slide it across? Yep. Alright. And then go ahead and do that with this one on that. Alright. Now I'm going to have you, can you lift up this leg? Alright, now you can rest it. And lift up this leg. Alright, you can rest that as well. And so then I'm going to have her push. Alright, so she had a nice, strong, equal push. So then I'm going to have her pull up towards your, okay. So that was also strong and equal. While I'm down here, I can also do my Babinski test. So we're going to start from the pinky toe side, and we're going to come in towards the big toe. So, and the patient's foot should curl in. That's a good sign for the Babinski test. The only ones we would expect to have a fanning out effect on their feet would be an infant. So that was a positive sign. We also noted when I did her feet that they equal bilaterally. When she lifted her feet, I didn't see any issues. She was able to lift both feet. No abnormal signs. I was also noting again her musculature, if she had any atrophy in her legs, which I did not see. And since she was able to lift both of them, that's a good sign that no atrophy has occurred in her feet. And she was also able to glide her heel down her leg, which is a good sign as well. And I believe that is it. Thank you.